I sure to affect it?
But we are live already.
Okay. Thank you. Good afternoon, ladies and gentlemen. My name is Dr. Adeyeye Emmanuel, and I'll be talking to you from Clearview Hospital today. I'm a young fertility physician here, and my job here will be talk to you about IVF, how it is related to fertility. Is the process harmful? Who can do IVF? And when can one opt in for IVF? And then, as a general summary, I'll just give a brief mental picture of what the process is like in two case scenarios at the same time. So, IVF simply means in vitro fertilization. In vitro fertilization means fertilization outside the body. And how is this related to fertility? Why would you want to fertilize someone's eggs with a partner's sperm outside the body? You want to do that in couples who are unable to achieve spontaneous pregnancy within 12 months / 1 year of actively trying. So infertility and fertility, I'll define them briefly. Infertility is the inability to achieve spontaneous pregnancy after 12 months of actually trying. In ladies less than 35 years old. So that 12 months now in ladies above 35 would be actively trying to conceive within 6 months, an inability to conceive within a year in ladies under 35, an inability to conceive in women above 35 is called infertility. Next question would be, is the process harmful? The process is relatively safe, and the only major complication of this would be what we call ovarian hyperstimulation syndrome, which might result from overstimulating the woman, or overstimulating our medications on background polycystic ovaries. It just simply means that the ovaries are over responding to your medication. Who can do IVF? I mentioned earlier 2 case studies: women under 35 and women above 35. For women under 35, they'll begin to think IVF if, for instance, they've been actively trying to get pregnant within 12 months without any success. And then for women above 35 years old, to be them trying to achieve pregnancy and not doing that within a 6 months period. When can they do IVF? It also bursts with that same concept of 1 year of trying under age 35, and then 6 months of trying over age 35. And then, so this will just take us to what the procedure summary is like, and I might be talking about so many things in this procedure summary, and it will also revolve around why we do what we do. So for instance, 35-year-old woman comes in. At Clearview Hospital, we have this pre-treatment bouquet that helps us to diagnose the cause of infertility. Without diagnosing the cause appropriately, you might not be able to tackle the problems the way it should be tackled. So for instance, this woman is 35 years old. She's been married for 5 years, but actively trying to get pregnant for 3 years. She comes to you, you do your pre-treatment screening, which is the hormone profile for her. And then what your hormone profile is showing you, normal hormone profiles in a normal case, or maybe in some instances you're suspecting PCOS, which is going to be confirmed, by your ultrasound scan. So we don't just diagnose you or figure out the cause of infertility by blood alone. We also run some ultrasound scan and what we call HSN. It's called saline hysterosonogram, which is just an advanced HSG without the pain that comes with it, and then the discomfort that's related to the dye that is used in HSG. HSN is more like a day case. You can have HSS done and still go back to work without anyone knowing what has happened. It's quite nice, and it's as revealing as the HSG. Like I said, it's more like an advanced HSG. And then, so in this lady under 35 years old, you've done the hormone profile, and then you've done your HSN. There are no polyps, but during your HSN, you notice that, in this patient, the tube might be blocked, right? And bilateral tubal blockage is one of those indications, regardless of your age, under 40, under 35, in the sense that at those ages you might still have access to eggs. The older you get, the lower the number we can access, and also the lower the quality. So in that lady that's under 35 now, you've done your hormone profile, it's quite normal. You've done your HSN, there are no fibroids, there are no polyps in the cavity where babies are going to be. But you notice that there might be some bilateral tubal blockage. In cases like that, the absolute solution is, IVF. And I want to use that to explain, who and when they can have IVF done. So she's 35, hormone profiles are normal, there are no fibroids, there are no polyps from your HSN, and now you're trying to look for the cause. So you figure out she's 35, she has bilateral tubal blockage. The best treatment you can render that kind of patient would be IVF, because you see those tubes are blocked is where the fertilization comes from. So you see in vitro fertilization, and I mentioned earlier that this is a process that helps us mimic the natural cycle outside of the body. And the lady we are talking about is still under 35, tubes are blocked. We are trying to help her get those eggs from the ovaries, fertilize that with her husband's sperm, let that culture in the lab for 5 days where it grows to the blastocyst stage, and then we can transfer back into her. In the natural cycle, at ovulation, the egg streams through the vagina, through the cervix, to the uterus, and all through to the tubes, to meet the eggs at the level of the ovary. Fertilization occurs, and from the moment fertilization starts occurring to 5 days after that, you now have the embryo, no longer just eggs, no longer just sperm, and embryo is what's supposed to grow and develop into a normal pregnancy. So you have fertilization happen at the level of the ovaries, but the fallopian tube is the transport system for these babies to find their way back into the uterus, to implant, and then proceed into normal pregnancy. If you don't have an active tube, at least one active tube, you can be rest assured that that process of fertilization is never going to occur. And if egg never meets sperm, pregnancy cannot occur. So that is a 35-year-old lady, good hormone profile, good uterine factor, but bilateral tubal blockage. IVF is the way out. And then, in our IVF treatment, we've done the hormone profile, we know where we stand. Her treatment most likely start on the 2nd or 3rd day of her menstrual cycle, which is called the follicular phase. So the follicular phase simply means, that the ovaries are recruiting follicles for that cycle that runs for averagely 28 to 30 days. And what happens is that in a normal cycle, in a lady under 35, you should be recruiting average of 15 follicles in that cycle. And the difference between a natural cycle and the IVF cycle that we're talking about is that, in a natural cycle, just one out of those 15 eggs, that begins to recruit themselves in the follicular phase gets to ovulation. While in IVF, we are giving you medications to help those other follicles make it, to about day 12, day 14, where we're going to collect the eggs and then fertilize them with the sperm outside the body. So in the natural cycle, averagely you have, 1 or 2 follicles get to ovulation and rupture, and then after the rupture, the sperm is going to swim from the cervix through the uterus, through the tubes, fertilize that, and then within 5 days, the fertilization that is occurring at the level of the ovary, is going to be transporting that product now, which is an embryo, back into the uterus. So in bilateral tubal blockage, that never happens. You have to do it outside the body, and once you get egg, fertilize it with the sperm, let them culture in the lab for 5 days, you can now transfer that product, which is an embryo, back into the woman for possibility of getting pregnant. So that is a mental picture for a lady under 35. So for instance, we also get a patient that's 40 years old. She comes to you, of course, at that level, the ovarian reserve is not as great as it should be when you're under 35, and the expectations for paternal medication might not be as good as that of a 30 or a 32 to 33-year-old lady. But this woman still comes to you. She's been married for 10 years, conceived for 5 years, but it's not happening. You run your hormone profile, you know that there's diminished ovarian reserve, which ultimately is relative to the quality of the eggs, and by the time you have those numbers declining, chance of a normal pregnancy also declines with that. So 40-year-old woman comes to you trying to conceive, hormone profiles are normal, ovarian reserve not so good, ultrasound scanning, antral follicles, and these are what holds the eggs. And in the natural cycle, out of those 14 eggs that are recruiting in the first half of that cycle, only one makes it to ovulation. So she's 40, she comes in, they give her stimulation medication to have her produce more eggs, which the response cannot be as fantastic as that of the lady at 35, and she has also maybe coexisting bilateral tubal blockage. That kind of woman too, the way to go with the IVF, and you want to be more aggressive because she's very closer to menopause, which we call the natural clock of a woman. So that being said, different patients, different interventions, different causes, different approach. But ultimately, IVF would be being able to replicate this process of conceiving, generating embryos outside the body, and then transferring the best embryos back into the woman after 5 days of fertilization and ejaculation. So I hope I've been able to break this down to you in a way you can understand. Our 6th-year anniversary at Clearview Hospital and Fertility has been called all the way. We have a long way to go to, and we always strive to make sure that we provide these services to you in a global standard and very well cost-effective manner in this part of the world. You can always reach us on our social media platforms, on our website. Trust me, pleasure will be all ours to reach out to you to answer all your questions. And you can always come in working to check out what we're talking about here. We really have everything you see. We have technology here. Yes, I can tell you that cutting edge technology are here that you can never imagine. Like you see in the movies. We have all of it here. Our doors are always open, and we try to be one of the leading fertility centers, not just fertility now. We try to be one of the leading laparoscopic fertility and gynecology center in this part of the world, where everything women and children is done by great specialists who work together to make sure that we get the best results in the shortest time frame and the most cost effective manner anywhere in the world.